All right, welcome back to the Simply Desert podcast. In this podcast, I am calling out all the bad nurses on Sunset Boulevard. You guys suck. I'm going to tell you my experience. Of all the surgeries I've ever had, that recovery was the worst I've ever experienced. It was so bad. And I couldn't figure out what it was about that place that made the recovery so bad. It's almost like they don't believe in giving people narcotics or anything for healing, right? It's like they have the stuff that they use to sedate and things like that. It's not the stuff that like other hospitals use. It's like bullshit stuff. I don't know how to explain it. It's so bad. So I shared my story a little bit of what happened, with the surgery and everything. And I ended up in ICU. Now, I remember while I was in ICU, when I started kind of coming to, a lot of times people are still under the anesthesia or whatever. And so they say things, they don't mean, or people react different ways. Well, I guess I woke up pissed off because I had such a headache. Like, my headache was... I don't even know how to explain. It was on the right side of my face, behind my eye, and it's just piercing. Like, it was so painful. And I remember asking, like, please, can someone give me something? An ibuprofen, something. Oh, we don't do ibuprofen here. We only do Tylenol. Like, what the hell? So that's how it started. Then I started getting pissed, but I'm still, in that state where I'm not awake, but at the same time, some of the stuff I'm saying, I know what I'm trying to say. I'm sure it came out kind of combative because, when I get upset, it could be pretty bad, right? And all I would do, I remember the doctor, he was standing next to me, and I was saying something like, what kind of hospital is this? Like, how come you guys don't have things that other hospitals have? And what I was talking about was pain relief. But I just started saying this stuff like, where's my electrolytes? Like, you don't even have me hooked up to anything to, make sure I'm okay or something. And I vaguely saw the doctor standing there, and he's like, wow, you're really pretty angry for someone who just had their aneurysm fixed, a complicated surgery fixed. And then that was the last I saw of him because, I have no idea what he said or anything. And my first nurse, I think I was the same with her. I don't remember her completely, but what I do remember of her, with all my bitching, she actually tried to help me. Like, she got there are certain medications that I'm supposed to do every day, right? Like, I have Flonase for my nose. I have to squirt Flonase for my sinuses before I go to bed. And then, she gave me my blood pressure medicine, and then, I don't even know what she gave me, the other thing. But it was stuff from my actual prescription, because they have my prescription, they see what I'm supposed to be taking. But one of them is my Ativan for my anxiety. And they refused to give it to me. And then I started telling them, I said, where's my Ativan? And she goes, well, you don't need it. And we don't want to give it to you because we just almost lost you. We don't want you to fall back asleep. And I kind of know, it kind of made sense in a way. But it was like nobody, but how about for my pain? Like, can someone help me with my pain? And here's the connection, but I just couldn't relay it, right? I started, the past month, I started getting cluster headaches. And I actually just figured all that out by myself, because they look at my test, they see nothing. They look at my brain scan, they see nothing, right? And they pretty much tell me that I shouldn't be feeling any pain whatsoever, because the pain, your brain does not have any nerve endings, and the surgery is usually an outpatient. But for me, because I was having cluster headaches, it wasn't, because I can't even explain the pain to you guys. It is worse than a migraine. It's like you want to die, right? It's so bad. And for me, the trigger is my anxiety. So if they give me my anxiety medicine, the headaches stop. But I couldn't relay that to them. So as time went by, I became more and more agitated. But the first nurse I had, she tried with me, but I wasn't there yet. I still wasn't awake. I still wasn't alert or anything. And I was having these episodes, because pretty much having panic attack on top of the cluster headaches. But they're telling me that I'm not feeling anything. There is no headache. And that I should be fine. And that was the argument, because they don't see anything on their blood work or something stupid like that. And I was so upset, So I think that first nurse, she did get me like a 0.5 milligram of Ativan, and I did chill out for a tiny bit. And then later on I asked, I was like, well, when it started all coming back, I go, was that like a 0.5? She said, yeah. I go, my thing is 2 milligrams. I go, please, can you go look at my prescription? My prescription is 2 milligrams twice a day. So please, can you get me the medicine so I could sleep, or, something, so I could start feeling better, because I just had the procedure done, and having my blood pressure raised like that before the coiling even scabs over, that's dangerous. It could still rupture, because it's got to heal up, it's got to clot up and scar over. And I started worrying about that, so of course everything was elevated. And then toward the end, she was really nice. She was checking my eyes, and I told her I was seeing these red spots. Like, just through the one eye, the one where I was having headaches, and her face was red. Like, there was these 2 red spots. She checked my eyes, and she told the doctor, she goes, her eye is dilated. So they gave me a CT scan to see if there was any bleeding happening. And he said there wasn't any, and I was like, I don't know, I don't care. All I want is my pain meds. So somewhere along the thing, she went home and introduced me to the nurse that was going to take over. So I get that nurse, and she was helping me a bit, And then the respiratory guy comes in. And usually I love respiratory guy, okay? Whoever the respiratory guy is, I love them. Especially like when I had pneumonia. Like, they're the hottest guys, and what they do is they give you your breathing stuff. I don't know what the fuck this kid was, but he sticks this fucking cup over my mouth, alright? Which I had to have because I wasn't breathing, which I understand. But one thing that helps cluster headaches is oxygen, okay? So it would help, but because they had my arms both arms filled with IVs. I couldn't bend my arms to adjust this cup that was over my face. He had it halfway over my fucking eyes. So this air was blowing full blast in my eyes, and I was trying to I was so pissed. I don't even know how to... I was so mad. And I was like, what the fuck? You know, I kept saying that. They go, she's cussing. And I was like, get this fucking mask off my eyes. Like, and my eyes started twitching, right? Because the air is blowing, like, right in my eye. I go, you don't have a mask that fits my face? Like, what is this? So, I moved it with my chin. I kind of like, I don't know what I did. And finally, they just gave me a tube. And I was like, thank you. Like, oh my God, what the hell? So I started calming down, all right? I started calming down. And the pain started going away a little bit and everything like that. And then this one damn nurse, it wasn't even my nurse. My nurse went to lunch. And I can hear this guy. He's some gay guy, right? He's sitting there going, I can hear him gossiping, talking shit about me, right? He's like, why is she here? What? Probably because, you know, I was upset or whatever. And he's like, I don't understand why she's here. And the nurses are saying, well, they had to bag her. You know, she's in, and he's like, oh, he goes, why does she have oxygen? And, you know, logically to me, I understand I have oxygen because I just started breathing again, motherfucker. You know? So he literally came and turned off my oxygen tank. He goes, I'm going to turn this off. He goes, I'm doing it. And he made sure, like, and he started talking shit about the nurse I had that went to go eat. So, as I was sitting there, getting more and more agitated because, of course, my headache, the cluster headache started coming back, and I was in such severe pain. And I was begging, you know, for painkillers. I was begging so bad, like just trying to find help, but at the same time, I still wasn't able to relate exactly my thoughts, right? Like I could basically say what I needed, but these nurses were like, for some fucking reason, they assumed I just want drugs. Like, you know, people who go to ER and they try to fake that they have this pain or that pain to get Vicodin and stuff. That's how they were treating me. Even though I was in ICU for a legit reason. It's not like I wanted to be in ICU. I just came back to life. I just had brain surgery, right? And and they're making it seem... I was just so pissed off. And this is where, you know, the stigma, you know, on my chart, it says anxiety disorder. So when they see that, it's a stigma. It's automatic. She's panicking. Not, there's a reason for her to panic. It's just automatic. So pretty much anything she says is not real, which is, you know, part of the reason I had such a hard time finding out I had the aneurysm in the first place, because I had to really fight the stigma of having that on my chart. And most people, I guess, not all, but some people who have mental illness, yeah, you know, they self-medicate through alcohol or cigarettes or their drugs, prescription drugs and stuff like that. I don't. I am too paranoid. That's why I have anxiety, right? Like, I'm afraid to take pills that have weird side effects and stuff. Like, the whole thing freaks me out. So the fact that I'm even asking for it meant I really needed it really bad. So the lady, this other nurse comes in. I go, please, I need my anxiety medicine, please, you know. And they just wouldn't give it. I stayed there for almost 2 days with absolutely no painkillers, without my anxiety medicine, which of course I started having my withdrawals on top of it, and with the cluster headaches. And I guess because I was making so much noise, the nurses started gossiping about me. And the one main thing was they pulled up my chart, and they were in a group looking at my medical chart, talking about it. And they were, look how many times she's been to the doctor this week, all the same, headaches, dizziness, all the same symptoms. And then they're like, oh, look at her medications, because, I got some hardcore medications that have been given to me, but I don't take them, I don't take them. They just give them to me because that's what they think I want. It's like, no, I want to find the root of the cause of my health stuff. Well, okay. So after all that happened, I finally got to go home. I was just like, get me the fuck out of here. As soon as I got in the car, I took my anxiety medicine, and I was fine. After about 10 minutes, everything subsided. The headache started subsiding. I had hardcore coffee. I think that's part of it too, withdrawals from coffee. And it all started going away. I mean, I still had the headache, but not as bad. And we just chilled, drove all the way back home, 3-hour drive. So when I got home, I tried to sleep, and I couldn't sleep because I kept thinking about what happened over and over and over again. And so I did call member services, and I did file a complaint. Now that a day's gone by and I think about it, I know I did the right thing. I just don't know how it came across because I was still, the anesthesia or whatever is not completely out of my body yet. So I don't know if some of the stuff I said were coherent. But I did write down everything. And the lady wanted to give me Wellbutrin. And she goes, well, you have Wellbutrin on here. I'm trying to help you. I go, that's for something else. That's for depression and other stuff, And she goes, see, well, I'm trying to help you. I go, that's not for anxiety. And you can't give that to me anyways because it can't interact with other drugs. That will kill me. And then she got pissed because she didn't even know what the fuck she was doing. She's trying to give me medication that will have, not understanding that it doesn't go with what just happened that day. So I did make a formal complaint, and I just, in all my years and in all the surgeries I've ever had, I think that's the worst experience I've ever had with nurses. And I was on Facebook talking to my cousin, and I forgot, she's a head nurse. And she was telling me, she goes, oh yeah, she goes, there are some real bad nurses out there. She goes, they do that shit. And I go, okay, so you don't think it's my imagination? She goes, no, it's not. She goes, some of them are, she's been in the nursing field for a while. There are good nurses, okay, just like there are good teachers. There are really good nurses, but there are some nurses that are young, right? And I'm not saying there's some good young ones too, but there are some that are just there for a job, and they didn't join that profession to help people or to even try to understand that they're actually helping people who are kind of not themselves. They're in pain. They're coming off anesthesia or other medications, and sometimes they say stuff that they don't even know what they're saying. And, their job is to care for them, especially if you're in ICU. You get one specific nurse, they're right in front of you watching you. And that's, there's one room to each nurse, And that's all they're supposed to do, is just be right there and take care of you continuously. And the one I had was okay for a while until I started coming out of it, right? And then I finally said something. I said, you guys are gossiping. And I said it really loud. And I go, I could hear every fucking thing you're saying. Stop going through my record, and I was pissed. Then so she comes in, she's like, no one's talking about you. No one's this and this but I know exactly what I heard, I know. And I hope they have cameras there or something to pick that up with my complaint, because I know that it will back up. And then later I heard one nurse say, yeah, we were talking about, that kind of stuff. So it was like, and I was so upset, like I was in tears because of the pain in my head. And I was just like, oh my God, get me the fuck out of here, you guys. So I was just trying to leave. And the thing was, I was supposed to be there for 24 hours for observation. But the minute I got there, they kept saying, why is she here? Why is she here? She's not that sick. That stupid gay guy. Okay? He's like, she needs, I don't understand. Like, I don't know who the fuck he thought he was. So then, but it's not, it's not up to him. It's up to the doctors. So, that is such bad nurses. I go back on the 21st to that floor. I really can't wait to go back there, because I'm going to go face them all, I try to be cool leaving, and just like, I'm sorry if I traumatized your floor, And they were like, oh my God, like, damn you people. Okay, so that's my nurse vent. Don't be a nurse, okay? Don't be a nurse if you really aren't there to help people. Yeah, it's a hard job. Just like teaching, there's a lot of hats that you wear. There's a lot of responsibility. But you're talking to people, especially if you work in ICU, you're talking to people who are really sick or that were near death. And the last thing they need to experience is your attitude or your gossiping or not being professional in any way. Your comments and stuff. And on the flip side, and I'm still making my complaint, I don't care. But on the flip side, they are human, or, and as humans, people make mistakes and do dumb things. And if these are new nurses, like just starting out on that floor and just learning the ropes, there will be mistakes and stuff. But I don't give a shit. I don't care if you guys see my name on the news. I filed the damn complaint, and I reported that whole floor. It was like, that was so dumb. I still see no logical reason why I couldn't be given pain medication or even some type of anxiety medication. It still doesn't make sense to me. They literally were trying to tell me that I wasn't having any headaches when I was having a fucking headache. That was the weirdest thing ever. Like, that was so weird. And then, as we started going home, somebody was telling me, they go, no, that place doesn't believe in narcotics. Like, it's one of those hospitals, like, they don't believe in giving people morphine or Valium or some other stuff that a lot of people need during the healing process. Because the thing is that you need those medications to heal. Because if you're agitated or you're feeling pain, your body's not going to heal. It's going to just escalate. Your brain has to feel like everything's calm for it to heal properly. And the fact that they made me stay there for 2 days in continuous, constant pain and begging, for my medication, I think I have something there. I don't care. I was that upset. So because of that experience, I'm tempted to change I think I have till the end of December to change my insurance or my place that I go. I mean, I've been with this one place for 5 years, and I think the difference is, and here in Bakersfield, the hospital here, they do it like a normal hospital. They use everything, the sedation medicine, everything's like a normal hospital. But what if I get stuck somewhere else in another place like that? I mean, they're dealing with the brain, and these people couldn't understand some portions of mental, like mental illnesses, like anxiety or, panic attacks, or like the nurses couldn't even understand that, even though it was a specific ICU for neurology. That doesn't make any fucking sense. Someone needs to fire their fucking asses. As soon as I'm healed and I'm down there, which is going to be the 21st, yeah, I'm going to face them all. And I'm going to tell them straight out. But right now, I'm just doing it through their HR. Okay, that's my vent. Okay, so no offense. There's a lot of good nurses out there. There are people, recent graduates, people who love their profession. They do want to help people, they like their jobs. But then there's those others who probably had their first job, right? They just graduated and they think they're so important that, they can make these decisions without the doctors knowing or whatever and really mess somebody up. Okay, I took my medication before this podcast, so I am about to pass out completely. I will try to come on air tomorrow. I've got a couple more channels I have to fill in for the iHeart, so I don't lose the account. And I told them to find me on iHeart because I was going to rant on their fucking asses. I still can't believe I went through that. And I talked to my brother. My brother's had a pancreas transplant, kidney transplant. He had the childhood diabetes. He was been in the hospital so much for coma, different things. And I asked him about that, and he said, yeah, there have been times where he experienced that, like where the nurses were just so mean to him. And he said and I wish I talked to him beforehand, because that was the first time I experienced that. He said he just grabbed all the stuff off the wall and walked out and got his own shit, and they were like, what are you doing? And he'd just be pissed, And the worst one he was saying was he was complaining about pain. He just had the surgery, and he kept telling them, I'm having pain, and it was the transplant. So nobody would listen to him. He kept telling them, he kept ringing the bell, telling them. So he said he doesn't know how he did it, but he pulled the wires off the walls. He walked out, had blood dripping all over his stomach, and walked out and just fucking yelled. I keep telling you guys, they rushed him into surgery. They left gauze in there. They left a couple of tools in his body. But the whole time, those nurses wouldn't take it serious, right? The stuff that he was complaining about. So, the moral of the story is if you end up in the hospital and you experience something like that, make a fucking noise. And what I should have done was ask for whoever was in charge, like a head up person. That's what I should have done. But of course, I wasn't quite out of the whole sedation thing, so I couldn't. I mean, I knew what I was trying to say and stuff, but it wasn't coming out right. But I'd like to see them try to mess with me right now, because I got thrown down. I'm so tired. Is that little thing a chat room? Let me see if someone came in here. Oh, Celtic Brony. Thank you for the hearts. I missed you. Oh my god. And they're like double heart. I have red, yellow, blue, lavender, a broken heart, a double heart, a spooning heart, an outlined heart with hearts with arrows going all different directions, and a cactus and a rose for Desert Rose. Thank you for coming by. I missed you guys. I don't think anybody noticed I was gone. I mean, I was just busy dying. But not anymore. I'm still, I think I'm okay, but I don't feel out of the woods. So today I finally got to take my shower, because I think all those germs, from everything, all those people touching me, and so I thought, okay, I better wash all this off, because I feel sick. Like, I don't know how to explain it. I feel like I have, an infection, or just sick. Like I had just all these germs on me or something. So tomorrow, when I wake up, I am going to start the day off with the apple cider vinegar drink and try to detox my body, because I don't know, for all I know, those people in LA have some funky ass stuff, and I gotta wash it out. I can try to detox myself and see if it all goes away, or if it's just mental, from my experience. But okay, I'm so drugged. I gotta go. I gotta go watch Pimple Popper on YouTube. I love this lady. I'm gonna message her and see if she could get this. I have a little bump thing on the side of my nose. It's not a wart and it's not a mole. I don't know what the hell it is. It's been there since I was 16. But I want someone to go in there and zap it off. So I'm gonna contact her, because she's here in Southern California. I think she's only 1 or 2 hours away. And the thing is that she will do it for free as long as she can videotape it. So I'm going to ask about that. I mean, if it's not free, I'll pay for it, because I think it's $100 to get one of those things off. But I'm going to... Anyways, what was I getting with Miss Pimple Popper? Her name is Dr. Sandra Lee Pimple Popper. That's her channel. If you see any other channel, those are copycats or people stealing her content. But it's really relaxing. I don't know why. It's been so relaxing. I just watch these people get poked. Okay, I'm gonna go, because my medicine just hit me. Thank you for listening. I'll be back having normal shows. This week. I'm hoping. I'm trying to get back to normal, back to a normal schedule. So for all those who listen, thank you for listening to my nurse rant. Thank you, Celtic. It's good to see you. Thank you for all the hearts. It made me feel better. Alright, everybody take care and have a good weekend. I might be here tomorrow night, depending how, it goes. And I might just lay here. I have no idea what I just said. Okay. Good night, everybody. Thank you for listening to the Simply Desert channel podcast. Okay.